Hello. In the second video about chronic pain, we're going to help you to look at how you might develop a plan to manage your chronic pain. But first, let's summarize some of the lessons that we've learned from our first video about chronic pain. A definition of chronic pain is pain lasting more than 3 months that does not seem to respond well to medication. We also think it's less about structural changes in the body, physically what's happened, and more about the brain and the sensitivity of the nervous system. It's possible to retrain the brain and nervous system to improve chronic pain, largely by being more active and doing different things. We also know that the structured approach, having a plan, helps people to manage their pain better. And it is that structured approach, having a plan, that we're going to look at now. So what things might we include in a chronic pain plan? The medical side is clearly important. Medication is useful for some conditions and some types of pain, but is generally less useful in chronic pain. We know that feelings and emotions are very important. Being anxious or being depressed can dial up the volume of our pain, and doing something about that can also reduce it. We think that our 24/7 lifestyle can sensitize the nervous system, so that we're much more likely to experience pain and for longer. Accepting that we have chronic pain is helpful, as is sharing our story with other people, either online or face to face. Agreeing a plan and review are important, and this is really what this video is about. Your GP or nurse or pharmacist or physiotherapist can help you to do that. We know that everyone's pain and circumstances are different, so your plan might be very different to other people's. Let's look at these areas in more detail. The medical side is clearly important. You might be waiting for a joint replacement, which might make a difference to your pain. Or you might have had back pain for many years with lots of investigations, referrals and different treatments, none of which have made a great deal of difference. Everyone is different, but the approach to managing pain is the same for everyone. Pain medication can be helpful, particularly to get going in the morning or during a flare-up, but taking medication long-term is now thought to be unhelpful and often does not improve chronic pain. Opiate medication, such as codeine, tramadol and morphine, only work 25% of the time, so most people who try them stop them because they're ineffective. Nerve medication like gabapentin and pregabalin work only 20% of the time, and even less in people with fibromyalgia. They also commonly have side effects, and there are risks of misuse and dependence. So pain medication is often not the answer. We know that our thoughts and feelings have a big impact on the brain and our nervous systems. Often periods of stress can dial up our pain, but doing something about it can also dial the pain back and make it more manageable. This may be an opportunity to learn some new skills to reduce stress and anxiety and to improve mood. Our local mental health service is called Life Cycle, and they offer an assessment and training to help you manage your anxiety, stress and low mood. You can self-refer, and there are details at the end of this video. But you may want to do it online. I've also made some links to services that help you work through some of these issues online. It seems that the modern lifestyle may not be good for our nervous system. What we eat and do may be contributing to sensitizing our nervous systems. But there are things that we can do to make a difference, like exercising, looking at what we eat and drink, and in particular drinking less alcohol. You might want to include a weight or alcohol reduction program in your pain plan. I've put more links at the end of this video. Befriending or accepting chronic pain, because it's unlikely to go away completely, is very important. That's true of anything difficult in our lives. Accepting it makes it feel less of a problem. We're back to that thing about the brain being a big influence in our lives. Sometimes this means letting go of asking for more tests and referrals with unrealistic expectations that will be a future magical treatment that will take our pain away. The problem of this approach is that it often diverts energy from looking at things that might make a difference, the things that we've been talking about in this video. For many of us, our personal stories about our chronic pain are wrapped up in who we are and the whole of our lives. Sharing your story can help you and other people. This might be in a pain or therapy group, like the group Pain Consulting in the Surgery, or it might be online, as in the local fibromyalgia Facebook group. After your doctor has listened to your pain story, you should be able to draw up a joint plan about what you want to do differently that might improve your pain. It has to be your plan and include things that you really want to try or achieve with help and support. So what might a pain plan look like? I thought it'd be very useful to share Frank's story and his pain plan. Everyone's pain and circumstances are different, so your plan might be rather like Frank's, or very simple, or quite complicated. But before we do that, we're going to summarise some of the things that it is important to include in your plan. Frank is 45 and he injured his back some 18 months ago in a road traffic accident. Since then he's had persistent low back pain, and this sometimes prevents him from driving, but also affects his sleep. When he first had the accident, he was seen in accident emergency, and x-rays of his chest and his spine at that time were normal. Since then he's seen 2 physiotherapists and a surgeon privately. He sometimes uses strong pain medication prescribed by the doctor, says he's drinking a bit more to help him sleep, and is very frustrated that his pain is not improving and that nobody seems to care. This is an extract from Frank's patient record. You can see that as well as describing what the pain is like, there are also a few other pieces of information that are helpful in understanding his pain. Just after his accident, after which he lost his job, his wife was found to have breast cancer and has had treatment from which he is recovering. And that may have been associated with his pain continuing. This is the plan that was agreed with Frank at the end of the consultation. The first thing I did was to record that he had chronic pain, because this was the first time that anyone had mentioned that his pain was chronic and may continue. The second thing was that he agreed to find out a bit more about chronic pain from our website, painnet.com. He put on a few pounds in weight and agreed to join his wife at Weight Watchers, and also cut back on his alcohol at night to help sleep. He also agreed to stop using his stronger painkillers as he had a stock, and to try just using ibuprofen or parecodol at bedtime and in the morning. I asked him to think about attending a pain group consultation meeting so they could meet with others and share his story. We agreed to review in 4 to 8 weeks' time to check on how he was getting on. We're approaching the end of this video. Thank you for staying right to the very end and not switching off. There might be some new ideas here that you might want to discuss with your GP, nurse, pharmacist or physiotherapist. My challenge to you is, if you have chronic pain, is what could you do differently that might make a difference to you and your pain? And also, how could we play our part in helping you to do that? Finally, have a look at some of the links at the end of this video. You might also want to give some feedback about what you like about this video and what you don't like. Thank you for listening.